Hair loss nowadays is a very common problem. Therefore, hair transplant is a very commonly performed cosmetic procedure to give a permanent solution to this problem. Hi everyone, I am Dr.Anshu Mishra. I am a cosmetic and plastic surgeon, and today I'll be talking about the procedure of hair transplant. When a person comes with a complaint of hair loss, the most common cause that we see is the hereditary hair loss. So this can happen both in males and females, and medically this is known as androgenic alopecia. Although there can be other reasons like aging, hair loss can happen after childbirth because of hormonal imbalances, because of any medications like chemotherapy. And there's another entity called alopecia areata, in which the immune system acts against the hair follicles, leading to the loss. If the hair are tied back or pulled back very tightly, then because of traction there can be hair loss in the frontal area. This is known as traction alopecia. So today I'll be basically focusing on male pattern baldness and how hair transplant can help you restore the youthful looks. Normally, the pattern of hair loss in males is such that there is hair loss in the frontal and the central part, whereas the hair in the back of the scalp are retained or they are spared. So in hair transplant, the donor area or the hair that we take are from the back of the scalp, and then they are implanted in the bald areas or in the frontal areas. There are basically two techniques of hair transplant, that is FUT and FUE. FUT is follicular unit transaction or a strip technique, in which a strip of skin is taken from the back of the scalp, and then the donor area is stitched, which is then covered by the surrounding hair. So the scar is not visible. Now, under magnification, from this strip, the hair follicles are then harvested and are implanted in the frontal area after making slits. Whereas in FUE technique or follicular unit extraction technique, there is no strip harvested. The individual hair grafts are harvested from the scalp directly with their hair roots using a punch. So this leaves small gaps which collapse and contract with time, making the scar imperceptible. So the method of implantation in both the techniques is the same, and the slits are made and the implants, the hair grafts are implanted in the bald areas. Now, what are the things that you should take into consideration before planning for the hair transplant procedure? First, you should be in a good health. So if you have any comorbidities like diabetes or hypertension, it should be well controlled. There should not be any active infection in the scalp. The hair should be dandruff free. And if you smoke, then you should withhold smoking for a minimum of 2 to 3 weeks in order to achieve good results. So how is this procedure done? This is done under local anesthesia, and it takes around 6 to 7 hours depending upon the number of grafts which are being transplanted. It's basically a teamwork. So small injections are given in the donor area as well as in the recipient areas to numb the area, to make the procedure more comfortable and painless for you. Then the hair are harvested from the donor areas, and according to the hairline design and the planning, they are then implanted in the recipient areas. So I have talked about the hairline design and the direction of implantation in detail in one of my previous videos. After the hair are transplanted, the dressing is done in the donor area, which is generally removed after 2 days of the procedure. You can go back home the same day of the procedure. Post-operatively, your doctor would prescribe you certain medications which you should comply with. You can resume your work after 2 days of the hair transplant procedure. So within a month of the hair transplant procedure, you will see the shedding phase, in which all the transplanted hair shafts would shed off, but the roots would retain, and then they will start regrowing after 2 to 3 months. So the results of hair transplant would take minimum of 6 months, and ideally you should wait for a year for the final results to come. So one of the most commonly asked questions during my consultation is, are the results of hair transplant permanent? So I would say that since we are taking the hair from the back of the scalp, which are permanent, and we are transplanting it in the frontal area or the desired bald area, the results are permanent and lifelong. So these transplanted hair are going to grow like your normal natural hair. You can trim them, style them, shampoo them like your normal hair. I hope with this video the basic concept of hair transplant is clear now, and for any further queries you can contact us. I will be happy to answer. Thank you.